Hi, everybody. It's my absolute pleasure to welcome you all to the launch of our 9th LuCE Report, which is about empowering voices. This report marks one of our biggest activities in November, which of course is Lung Cancer Awareness Month. Next slide, please. So just to briefly go through the event outline, we will have an EU perspective on lung cancer from MEP Andriukaitis. I will then present some highlights from the 9th LuCE report, and we will then have perspectives on knowledge about lung cancer and shared decision-making from a clinical, personal, and caregiver perspective. And I thank Georgia, Nicolene, and Jan for being here with us. We then hope to have some time for Q&A before a short video message from MEP Kelly, followed by a brief summary and our very important call to action, which will close out our meeting. So without further ado, I'd like to formally welcome you to this launch event, and thank you all so much for being here with us today. I'd also like to give a very special thanks to our host, MEP Andriukaitis, and I'd also like to thank our speakers and give a special note of welcome to them as they put in so much time and effort into our event today. A special welcome and note of thanks to ELF, ERS and Lungs Europe for their support of the event, and to Alfonso in Mission Control for today's event. A sincere welcome to each and every one of you, and thank you all so much for your support. So it's now my pleasure to introduce MEP Andriukaitis. He has been a practicing surgeon with specialization in cardiovascular surgery. He's also served as Minister for Health in the Lithuanian government, and then served as European Commissioner for Health and Food Safety. So MEP Andriukaitis, thank you so much for hosting us today and supporting our event, and I'll pass over to you for an EU perspective.
Thank you very much indeed. Good afternoon, everyone, colleagues, like-minded friends. I really thank you for joining us today to speak about such very important topic for all Europeans. Now, lung cancer is one of the biggest killers, and it's very difficult to see those patients who are suffering from lung cancer, because, as you know, it is a very high incidence, high mortality, and quite poor quality of life compared to other types of cancers. You know, also today in European Parliament we voted, about a resolution on to reduce air pollution from tobacco and from e-cigarettes. But unfortunately, the resolution was not adopted. And this shows once again how it is important now to speak about lung cancer, and to show necessity to fight against tobacco, to reduce number of smokers, to guarantee indoor outdoor air quality, because it is all because a lot of risk factors who are provoking lung cancer are in our cigarettes. I'm delighted to be part of this online event and speak about the 9th Lung Cancer Europe report on lung cancer. It's very timely, It's true public health priority. Lung cancer remains one of the deadliest cancers, and early detection is essential to improve survival rates of patients affected by this disease. As cardiosurgeon, I know very well situation when I see lungs, those who are smoking and so on. It's very painful picture always which stays in my eyes with those patients who suffer from lung disease, especially lung cancer. It is important to ensure that everyone can have access to the latest available information about early diagnosis, early treatment, about possibilities to improve quality of life. There are also multiple challenges patients face once diagnosed, and we need to continue working together, once again, to make sure patients can be treated in a proper and especially timely manner across Europe, regardless of where they live. And then early diagnosis, early treatment, and early interventions. Only one way to reduce, numbers of deaths related to lung cancer. And accessibility and availability of medicines and care is a fundamental to ensure the best possible outcomes of these affected by lung cancer. It is a key to have evidence-based documents, and such a report shows very clearly evidence-based, reality with real-world data and testimonies from patients to raise awareness on their needs. It is important to place patients and patient-centered approach developed to place patients individually at the center of the care process. Then those impacted by lung cancer are empowered to take an active role in managing their disease and their situation. They are in quite, conditions to understand what works for them and what doesn't. This is why patients should be involved into decision-making process. Of course, it's a very difficult issue. We can allow patients to be part of our common efforts to overcome lung cancer. Patient involvement in decision is associated with the positive outcomes, such as increased knowledge about the treatment and care options and better quality of life. Of course, it is obvious. We need to work together with patients, patient organizations, with doctors, experts, and of course, with policymakers to achieve the best possible result. Because if policymakers do not understand what does it mean, possibilities to fight against tobacco, to reduce air pollution, to guarantee access to healthy environment, it's always very difficult to see to promote preventative interventions. Policymakers should understand that lung cancer require very strong preventative programs and preventative campaigns fighting against tobacco and of course promoting promoting such information that lung cancer is preventable. We need to understand that prevention is better than cure, but prevention requires a lot of our common efforts, especially from politicians' side. And I think this report can show us the evidence-based situation, and I welcome this ninth Lung Cancer Europe report, and we will follow you closely and to use such a report in our debates, being together with you and doing our utmost, our best to achieve better results to our patients, and of course also to develop some more effective preventative and all other treatment tools. Thank you so much.
Thank you so much, MP Andriukaitis. I mean, you've covered such a broad range of things that we talk about every day within the lung cancer community, particularly in terms of timely access to diagnostics as well as treatment and care, because we know all of these things can make such a huge outcome to people at risk of and living with this disease and their families. And as you say, we need to all work together and do this together as a community, because it's only when we get everybody on board and all of the stakeholders together that we'll really see that true change and that true value in the real world for everybody in our community. So thank you so much again for being with us and for all of your messages of support. MEP Andriukaitis, we really appreciate it. So thank you. So I'll ask Alfonso to bring our slides up again, and it now comes to me to give you some of the key takeaways from the 9th LuCE report. So next slide, please, Alfonso. So a brief outline of what I'm going to cover during this presentation. I'm going to touch upon the introduction to this report. I'm then going to cover some of the aims and briefly go through the methodology with you. And then I'm going to give a very broad overview of the participant demographics. This report really had three core or key themes, and I'm going to give you some key takeaways from that. And that was around knowledge about lung cancer, access to information, and shared decision making. Next slide, please. So one of the reasons that we undertook this report under this topic of empowering voices is that a number of our members and people in our community have previously indicated that there's a lot of issues around general lung cancer knowledge, issues around accessing information, and it wasn't necessarily is the information there and how do I get it, but also in terms of is that information accurate, is it up to date, or are there gaps out there in information that we need in our community? Shared decision making is something that we talk about so much. And I think given that this word is so used routinely, people think that it's a reality for everybody. But of course, in our community, we know that there are many issues around shared decision making, and it really isn't a reality for very many people in our community. So with these things taken together, we felt that there was a need for improved understanding of people's experiences, preferences, and needs. And then from that, looking at how all of this influence of this knowledge was on individuals' treatments and decisions regarding their treatments and care and all of the different types of things they will experience on their lung cancer journey. Next slide, please, Alfonso. So in terms of aims, we had a number of aims for this body of work, and that was around exploring this level of knowledge around disease, diagnosis, treatment and care, looking at accessing information, what were the key barriers, the preferences, the experiences, and then looking at that involvement in treatment and care decision making, looking to see was it a reality, but also trying to identify some of the challenges that people are facing in terms of active engagement. We also then wanted to look at some interventions that might be able to be put in place to improve education around the disease and really truly enable that shared decision making for our community in daily practice. Next slide, please, Alfonso. So in terms of methodology for our 9th report, it really follows through from all of our previous reports. We convened a working group which consisted of LuCE members. There was an extensive literature review undertaken, which informed our survey design, which underwent a couple of iterations. Once this was complete, it was then disseminated online for a number of months earlier this year. And then from that, it underwent data analysis. And then we had preparation of the final report in the toolkit, which I'll show you a little bit later on. Just to say, what I'm going to present to you in the next couple of slides is really only a snapshot of the data that was generated from this report. It really is one of the most complex reports that we have done and undertaken. And in some instances, we were able to take a longitudinal look whereby we were able to see what the responses were like in 2024 and compare them to responses from previous reports to see if there was an improvement or a decline in some of the themes and areas that we were asking about. Next slide, please. So in terms of demographics, I'm just giving you a very broad snapshot here. But we had the most respondents ever to our LuCE survey with over 2,000 people. The majority of these were people with lung cancer, but you can also see that we had a significant number of those in a caregiver capacity. As with other LuCE reports and with other studies in the literature, the majority of our respondents were female, living with non-small cell lung cancer, particularly of the adenocarcinoma subtype, and living with stage 4 disease. For a number of people, the biomarker status of their tumour was unknown. However, we had quite a large representation from those living with EGFR positive and ALK positive lung cancer. And the majority of our respondents overall came from France, UK, Spain, and Greece. Next slide, please, Alfonso. So in terms about knowledge around lung cancer, we want to look at before diagnosis and after diagnosis. So if we initially just look at risk factors, so in general, there was good knowledge around some of the more well-known risk factors, but we did see things like previous radiation to the chest. People didn't have as great awareness about that and compared to maybe secondhand smoke or pollution. And also we need to do better about increasing awareness around family history and how that is associated in with risk factors as well. In terms of symptom knowledge, there was only 2 symptoms that were known by more than 50% of our respondents. And that was that persistent cough that a lot of people experience, as well as shortness of breath. Within our survey, we did give a list of a number of different symptoms that can be associated with lung cancer, but really 7 of these symptoms were only known by less than 15% of our respondents. We also wanted to ask about screening in this report because we know there's been movement, obviously, about 2 years ago now around the EU Council recommendations on screening guidance for cancer. And we know that a number of countries are looking at implementing screening programs. So when we asked about that, only about 40% knew what lung cancer screening was. And of that, nearly 50% did not know if there was a lung cancer screening program in their country. So we definitely need to get the word out more about screening. In terms of seeking medical advice, again, we're seeing quite large percentages of people not necessarily recognizing a symptom as lung cancer and sometimes misattributing symptoms to other conditions, which then contributed to delaying medical advice. Next slide, please. When we look at after diagnosis, again, we're looking about a quarter to a fifth of those that still felt they didn't have a good level of knowledge around their disease. They didn't understand the prognosis of the disease well. And then again, we have a significant amount of participants in our survey that did not know if their tumour was positive for any biomarker. And we know that having this information can really make such a difference in terms of the support that people can receive and how they themselves can find out knowledge about their specific type of lung cancer. When looking at knowledge about treatment and care, again, some of the key things that stood out was clinical trials, palliative care, biomarkers again coming up, and radiotherapy as well. Next slide, please, Alfonso. When we then went on to the next theme of our report, which was around access to information, we also found that there was issues around this in terms of experiencing some issues with information during the disease journey. And as you can see, it's about a quarter of our respondents or greater for the vast majority of the options that were available. But there was issues around having unclear information, lack of information, difficulty processing all the information that was given, and then issues around not having enough time to ask questions and feeling there was issues around communication with healthcare professionals. There was a number of other information needs around treatment, and these were quite significant around their treatment plan, with about 50% stating it was either medium, little, or none. Supportive services was also something that people felt there was an issue around information. And again, almost 60%, it was medium, little, or none was the response. And then other alternative treatment options really stood out, with about nearly 80% or just over 80% feeling they had only medium, little, or no knowledge around other alternative treatment options. And if you just advance again, Alfonso, I just have one last image on the slide. There was a number of factors that influenced the exchange of information with the healthcare team. And the key things that came out here was limited time for information, communication with healthcare professionals, issues around health literacy levels, and then the utilisation of complex medical terminology as well. Next slide, please, Alfonso. So looking at access to information in a little bit more detail, we looked at what type of information or support people felt that they lacked. And in this instance, we were able to do some comparison with the previous report in 2021. So you can see there's not really huge differences between then and now. And there's still a lot of issues around accessing nutrition and exercise, medical information, psychological counselling, and so on. Management of side effects was something that really comes out time and time again. And people really felt that they were ill-equipped to manage symptoms and side effects. And when they went out looking for information and support around the management of this, and this is looking at caregivers, again, a lot of them only had a little bit, not at all, or somewhat had received information and support that they needed to support their loved one with managing side effects. Next slide, please, Alfonso. And just to finish off this key area around access to information, it's really key to see that the vast majority of our respondents went to look for information outside of our their healthcare system. And although a lot of people felt that they typically found the information they were looking for, we can still see that there's about 25% nearly of people who felt the information was questionable or that they didn't find the information that they were looking for. So again, room for improvement around here. And when we look at sources of information, if you can just click again, please, Alfonso, we can see that the majority would have gone to places like social media, patient organisations, and the internet as sources of information to get lung cancer, but it is spread across a number of different areas. When we come to our last part of one of our core themes of our report was around shared decision making. So the vast majority of our participants believed that their opinion should be considered in the decision-making process. However, despite that, quite a large percentage reported to having been not highly involved in decision-making. Even if they were, they felt that their opinion was not being considered. And then it's really worrying to see that just over 40% felt that the treatment and care plan did not align with the preferences of the person living with the disease. So overall, just over 40% did not positively value their involvement in the decision-making process. So we really need to do more around shared decision-making. Next slide, please, Alfonso. So this is just my last slide now of the snapshot and sort of whistle-stop tour of our 9th report. And this was looking at what kind of factors might influence in terms of deciding on treatment. So we do see that over 75% of those followed their physician's recommendations. However, out of that, nearly 30% disagreed with their physician. But even with that disagreement, about 22% did not disagree or did not discuss their disagreement with their clinician. One of the big deciding factors when looking at treatment was looking at pain as a main concern about making this decision. And then there was a number of obstacles to meaningful participation. And this comes back to the complex information and poor communication with healthcare team. So even though we looked at 3 key themes, you can see that there's a thread woven between them in terms of information needs, understanding information, and then communication with the healthcare team. So that was my last slide on some of the key takeaways of our report. And I know it's a lot to digest, so you'll have a lot of reading when you look at the report in its entirety. So we're now going to move on to the next speaker. So if I can just thank you so much, Alfonso. And it's my great pleasure to now introduce our next speaker, who's going to give a clinical perspective. So I'd really like to welcome Dr. Hardavella, who's a consultant respiratory physician at Soteria at Athens Chest Diseases Hospital in Greece, with a special interest in lung cancer. She is Secretary of Assembly 11, Thoracic Oncology at the European Respiratory Society, and Chair of the Lung Cancer Group at the Hellenic Thoracic Society. Georgia is a strong advocate of patient and public involvement in research in clinical services development and has worked very closely with the ELF in a number of their projects that they have. So over to you, Georgia, and thanks so much for being with us today.
Thank you very much indeed for the kind introduction and the invitation. I'm really excited to be amongst you today because I think our interaction with patients is extremely meaningful, because at the end of the day, they're the recipients of the care we provide. And I think, I'm pretty sure, and based on what you have just presented, Anne-Marie, I think we really need to reflect on the results of the survey, and pretty much a lot of discussion is going to be generated later on. Alfonso, can you? Brilliant. And I've changed my connection, by the way. So is there any possibility I could have control of my own slides? If not, I'll be just saying next all the time.
Of course.
I'm sorry for this last minute thing, but I
all.
just managed to sort out the connection. Thank you.
If you want,
No
you
problem,
can just share.
Georgia.
You can share your own screen,
Yeah,
Georgia,
yeah,
and you can
yeah,
go through
yeah.
the slides.
Will do. Okay, thank you for that. Just bear with me,
And
please.
I'll let you know when we can see them.
Yeah. I mean, for the tech gremlins to stay away just before the end of the year would be too much to ask for, I think. So we're all having different tech issues today, which is always the case when it comes to these meetings. So we'll just give Georgia a minute or so to get the slides up.
Okay, so if you just put them on full screen mode, because we can see your, yeah, that's it.
Perfect.
We can
Thank
see the
you.
screen.
Thanks for bearing with me. Brilliant. So I'm just going to crack on. So in the next few minutes, I'll try to offer a clinical perspective. So a clinical perspective in lung cancer with regards to two major terms: knowledge and shared decision making. And I'll try to offer you the perspective of a physician who is a lung cancer expert and works in a tertiary center that diagnoses and treats over 1,500 patients per year. So as a clinician, as a lung cancer expert, I'm meant to have knowledge of certain facts to be able to facilitate the shared decision-making process with my patients when it comes to the diagnostic and treatment part of the lung cancer pathway. The question arises, which facts I need to be aware of? And as a lung cancer expert, by default, I've got an inclination to be consistently up to date with all the latest lung cancer guidelines in terms of the diagnosis, treatment, palliative care, screening, early diagnosis, so all the spectrum of the disease. So that's a box that is ticked. I also rely on my experience, so having worked in big tertiary lung cancer centers in the UK and then transferring this experience in Greece, working in a tertiary center. So I tend to, let's say, translate my previous experience into my daily clinical practice with my patients. I rely on evidence. So there are certain things that appear to be as dogmas in daily clinical practice, but I always question whether there is enough evidence to back those aspects. And when there is not evidence and there is no clear benefit for my patients, I will not go through the process and I will try to find the best alternatives for them. And then I need to be aware of the disease goals. So what are we aiming in terms of the diagnostic that we will offer to the patient or the treatment approach that we will offer to the patient? So that's my pure, strictly clinical approach. And then I need to be aware of patient-related factors that are going to be further interpreted and mentioned in detail by the next speaker. So I need to be aware of my patient's lifestyle, their values, their preferences, what they prefer, the available resources, and the personal goals. So what is the patient after? What does the patient wish at the end of the day? And this works in a kind of reciprocal way and facilitates the shared decision process, the shared decision-making process between myself as a clinician and my patient. If for whatever reason, one of the two sides goes wrong, then we are in a situation which I tend to call the silent misdiagnosis. So even if I'm aware of all the latest guidelines and the best possible clinical approaches, if my patient is not aware of all the reasonable options and all the potential outcomes, and if I'm not aware of my patient's preferences, then we're going to end up with an uninformed decision. And then this decision is definitely going to be regretted. So it's going to be a really thorny situation. The lung cancer pathway is probably the most complex pathway in terms of solid tumors. So the most complex pathway in terms of diagnostics and probably the most complex in terms of treatment. And we all work on the assumption that the destination is predetermined. Everyone as healthcare professionals are trying to do their best. And each step leads to the next logical step on the pathway. But as a clinician, I always wonder, do we make assumptions as clinicians? Do we assume that our patient really wants to go ahead with this particular treatment or with this particular complex diagnostic? And do we embed personalization in our conversations with the patients? And that's a huge chapter as to whether we personalize these conversations and we tailor them to our patients' needs. And there has been quite a lot of research out there that has been published. I'll just mention just one paper that reflects what is happening on the early stage lung cancer, which is less complex than the more advanced stages of the disease. So according to this survey that was published 7 years ago, and basically they included clinicians, as in lung cancer experts, medical oncologists, radiation oncologists, respiratory physicians, the two key messages were that the majority of clinicians agree that it is important to involve lung cancer patients in treatment decision-making. And the second message was that there are time constraints, and everyone complains about them. And this is something that was always also reflected in the LuCE report mentioned by Anne-Marie earlier. And there is also inability of some patients to make a weighted decision. So these are important barriers. And as a clinician, I wonder, why is the majority of clinicians in agreement that we should involve our lung cancer patients in the treatment decision-making and not all of them? So there's probably an issue there. Time constraints, yes, it's a universal issue with healthcare services, but why do we say there is an inability of some patients to make a weighted decision? Is it just a time constraint? Is it because we're not giving them enough information? And again, this reflects back to the LuCE report that was presented earlier. And then my big question is, do we need standardized clinician education in shared decision making? Because remember, there's a variation in practice across all countries. We've got different levels of training, and the clinical perspective is completely different from country to country. And this has been reflected in previously published papers by the ERS Thoracic Oncology Assembly. There's a great diversity across European countries in terms of the healthcare systems and in terms of the lung cancer services. And in the latest guideline we published last year in the ERS, we actually set the question as to whether lung cancer patients should have access in patient decision tools that would facilitate the decision-making process rather than not having any access at all and not having any involvement. And the answer is a huge, bold yes, even though there is not enough evidence to firmly back this up, but it seems that the benefit is significantly more than any potential risk. So it seems there is a foggy situation there in terms of the shared decision-making process across European countries, but we need to be able to formulate that and have it in a well-structured way. And these are a couple of papers that were published in the last couple of years regarding the shared decision-making process in different lung cancer centers. And it seems that there are some common themes. So the clinicians are generally advised to offer their patients access to patient decision tools because they will improve the patient's knowledge. And remember, according to what Anne-Marie presented, almost 1/3 of the patients do not have clear awareness of what the treatment plan is going to be, and 40% they don't have a clear awareness of what the biomarker status is. So these patient decision tools are meant to reduce the decisional conflict. So they clear the way and they clear the thoughts of our patients and make them be able to participate actively in the shared decision-making process. And also they empower our patients to make informed decisions that align with their personal values. Yes, time constraints are always going to be an issue. I'm not sure how we will be able to resolve them in the near future. But the downside is that we don't have shared decision-making tools for all the parts of the lung cancer pathway because it's quite complex, and we do need further validation. So to summarize all this and create some food for thought, yes, there is variation in practice. We acknowledge that as clinicians. As lung cancer experts, we should be able to consider not just the clinician, but also the patient aspect. And we need as clinicians to be able to embed personalization in our conversations. So it's not just about reiterating the diagnostic or treatment plan, it's making it specific and personal for our patient. Time constraints, yes, always an issue. And my big question, and one of the things that have been hanging around my thoughts following today's meeting, is going to be whether we need a standardized clinician training in shared decision-making, and how we will be able to have a structured training with significant input from our lung cancer patients. Thank you.
Thank you so much, Georgia. That was such a fantastic overview of all of the different things that we should be taking into consideration. And I think it's, you know, with the patient decision tools and, you know, what you've mentioned about sort of this bias or kind of assumptions that come, and all of that makes a complex pathway even more complex. So I think really, you know, what we need to ensure that we're doing is that any of these patient decision tools or tools that are made to support shared decision making actually have patient and advocate involvement in them, because we have seen at times tools made for people, but yet the people that they're made for are not included in the process. So then you sort of have something, but is it necessarily as fit for purpose as it should be? But absolutely excellent overview. Thank you so very much for being here and for giving that talk for us today. So with that, I'd like to introduce our next speaker, which is Nicolene Earhart. Nicolene is a board member of Segenau, a co-founder of ALK Positive Germany, and co-founder and chair of ALK Positive Europe. And before Nicolene starts her presentation, I'd just like to say a personal note of thanks, and thanks from LuCE for being such an active participant within our working group for this report, and also being here with us today and being active in all of the LuCE activities. So I'll pass over to Nicolene now, who's going to take us through a personal perspective.
Thank you very much, Anne-Marie, for this kind introduction, and good afternoon to everyone. Next slide, please. In recent years, there have been major advances in the diagnosis and treatment of lung cancer, and of course, improvements in the care for patients. However, the LuCE report shows that we are still far from perfect situation and highlights important aspects that we must not lose sight of. And behind the figures we've just heard, are the stories of individual patients and caregivers that we as patient advocates hear every day. And I would like to share one of them with you today to turn all that numbers into a face. Next slide, please. And a few months ago, while working for ALK Positive Deutschland, I met Maya, a woman in her early 50s who had always been active and healthy. She'd been dealing for 3 months with what she thought was a persistent cough because of allergies. Life was busy, so Maya, like a lot of other patients, brushed it aside until her cough worsened and she felt unusually fatigued. So she sought help from her family doctor, which is for most patients the first point of contact in their lung cancer journey. And what followed was a medical odyssey, you can't call it in any other way, that lasted for almost 8 months. And all the healthcare professionals that were involved, and a lot of waiting time for appointments, of course, but none of them had considered that it could be lung cancer. And this highlights a major problem that we also saw reflected in the report, and the lack of awareness, not only among the public and patient, but also the lack of awareness among HCPs, some of them. Finally, after a CT scan and a biopsy, she was diagnosed with stage 4 lung cancer. For Maya, her diagnosis, of course, came as a total shock. She told me that she didn't even know that she could get lung cancer because she thought that it was something that happened to other people, not to her. Next slide, please. And so this is a typical case of a patient. And one of the key lessons we've learned from Maya, and of course countless others, is the importance of awareness. Patients' lives and outcomes could be profoundly improved if only they had access to better information and earlier detection. Next slide, please. And of course, after the diagnosis, the story doesn't end, and it becomes even more critical to support patients in this situation. Maya shared with me how lost she felt. She really felt lost during her early consultations. Medical terms like biomarker, staging, treatment pathway, targeted therapies, outcomes were thrown around, but no one explained what those terms mean in a simple language. When Maya was presented with a treatment plan, she was handed forms to sign, but wasn't given a real chance to ask questions. She didn't know there might be alternatives to consider, that she could ask about side effects or anything else. She told me I felt like I was just going along with whatever they said. And our data from the LuCE report reflects this. Nearly 30% of patients report having poor knowledge of their condition. And almost half feel they don't get enough information about treatment options and potential side effects. Informed decisions are impossible without clear, accessible communication. I didn't even know what to ask, she told me, and no one told me what I should be asking. Maya realized really quickly how little she knew, not just about lung cancer, but about how to navigate the decisions in front of her. And this was the reason why she joined a patient network, because she had hope that she could find all the answers there. And Maya's story, of course, is not unique, and it highlights a series of challenges that many people diagnosed with lung cancer face, feeling lost, uninformed, when trying to navigate their care. Next slide, please. So we need to focus on empowering patients by giving them all relevant information. This starts with healthcare providers using clear, compassionate communication, because every patient deserves to understand the diagnosis and treatment options in a way that feels accessible and comprehensive. Next slide, please. Fortunately, Maya's story doesn't end here. At turning point, because she felt so insecure with her oncologist and with her lack of information, that she decided to sought a second opinion. And her new oncologist approached the conversation totally different. He took his time to explain her options in plain language and asked her about her priorities, what she wants, what she expects. And this was something she didn't experience before. For the first time, she felt like a partner in her care. And together they crafted a treatment plan that aligned with her goals and priorities. So, for example, enable her to spend more time with her family, keep on working, things like that, while managing her disease, and of course, her side effects. And I think this is the essence of shared decision-making. It transforms care from something that happens to the patient into something that happens with the patient. And this is really important because it empowers the patient and the caregivers to take ownership of their journey, and armed with knowledge and confidence, you can master this journey. And next slide, please. Thank you. And let me just have a little bit of a closing thought as we reflect on Maya's journey, and of course, the story of so many others. We have to remember that this fight against lung cancer is not just about treating the disease, it is about supporting the person. It's about giving every individual the knowledge, tools, and confidence to face their diagnosis with hope. And I'm absolutely sure, even if it will last a little bit longer, that we can make this a reality. Thank you.
Nicolene, thank you so much for that powerful talk. I mean, so many things that you've touched upon there are things that have come out in this report. And thank you so much for sharing Maya's story with us and going through all of that. And I mean, I think for anyone who is here and who's doubtful around shared decision making, we can see that that has such an impact. And you know, communication is really key. There's treatment, but is that treatment aligning with treatment goals of the individual and their families? And then with that communication as well, it's ensuring that it's done in a very clear and empathetic way, so that you do build that relationship and that trust is there. And it is being that partnership, and that was so clear from your talk and the difference that can make. So thank you so much, Nicolene, for being here and for sharing that with us today.
Thank you.
So I'm now going to move on, and I'm going to introduce our next speaker, which is Jan Clark, who's Secretary and Co-founder of Oncogene Cancer Research. And I would also like to say a personal note of thanks and thanks of LuCE for the amount of activity and support that Oncogene Cancer Research gives to LuCE and the activities that we do. So thank you for being such an active member of the organisation, and thank you, Jan, for being here today and sharing your caregiving perspective with us. So I'll hand over to you, Jan. So thank you so much.
Thanks very much, Anne-Marie, and thanks for inviting me to present. So as Anne-Marie has said, I am part of Oncogene Cancer Research. I'm co-founder, and also I am mum to Amy, one of my daughters, who was diagnosed with ALK lung cancer back in 2020. Next slide, please, Alfonso. I just want to go through, when I was reflecting on how, when I put this presentation together, how Amy and I worked together as a team. And for that reason, I wanted to start with the relationship, because the care-patient relationship is so important, because it's a partnership. So there may already be someone from day one to support you, or you may need to go and find someone to offer that support. Because you've got to remember, this is a very stressful time, as you will be shocked and upset with a new diagnosis. Most people will need support on this journey. And without a strong supporting relationship, you can have all the knowledge or access to it, but it will affect the decision-making process. Amy and I were really lucky. We did and have a great daughter and mother relationship, so it worked very well from the start. So once you have this relationship in place, you can work together on the knowledge and decision-making process. So it sort of flows as like I say, as a process. Next slide, please, Alfonso. So why do we need knowledge? What does it give you? For sure, it's so important, but without it, you can't make any informed decisions. So I've just put some of the thoughts I had about what does knowledge mean to Amy and I and to other people. So it means control. If you know and have that knowledge, it makes you more in control, because when you are faced with a diagnosis and being a carer, caregiver, mum, whatever, is that you're out of control. So it gives you control. It gives you courage. It gives you hope. It empowers you to to manage the future. You don't know what it is, but it helps you empower you. It makes you proactive. It gives you more of a stress-free environment because you're so stressed at the beginning because you don't have any knowledge. And that really reflected when Anne-Marie was going through the report. There's a lot of people out there that just still don't know and didn't know at the beginning. Positivity, you need to be positive. It gives you that positivity, and it makes you become an advocate, and really ability to challenge, which is not easy to do, which I'll cover. But all in all, knowledge will give you that power. It makes you powerful. It makes you in control. And I think for Amy and I, that's really part of the journey to take back control and be able to manage what's happening to you. So just a bit about us. For as a family, we were lucky. I worked in the medical industry, so to have discussions with clinicians was not unusual for me. In the early days, we knew we needed more information, but how do we get it? We didn't know what we needed. So we sort of embarked on this journey of what were we missing, but we don't know what we're missing, if that makes sense. I personally had to upskill quickly on social media, as they weren't my best skill set, as these platforms educate you and give you the access to valuable contacts. For Amy, she knew I could take the lead, as she trusted me, and being so young, as she was 20 when she was first diagnosed, she honestly, and still does, just wants to get on enjoying her life. So, but I do appreciate for some people, it isn't easy to do that. I didn't believe everything I was told and made sure I validated it for myself, as people are well-meaning, but not always accurate in what they're telling you. And we started to doubt the knowledge within the local trust Amy was under. So having accumulated and equipped ourselves with more knowledge, we decided to move to a centre of excellence. And to be honest, it was like going from night to day, moving to a specialist in the ALK arena. So we still challenge the Centre of Excellence and have discussions with specialists outside of the UK, ready to equip ourselves for the next conversation when Amy will progress. And I think being in control and being able to have that knowledge will allow Amy and I to ask meaningful questions and explore alternative treatments or trials, for example, in the future. And again, this is something that came out of Anne-Marie's report, that there's a great need for that knowledge to be more readily available for people. Next slide, please, Alfonso. So what were the challenges, and what challenges will people face? And what we can share is, how do you find out what you don't know? Where do you start? So I started with in the early days, I didn't know where to start, to be honest. I went to Amy's drug company, and this is 4.5 years ago. I actually went to them in the States and asked for some guidance. And then I found a UK charity. I wasn't given that from anywhere in the clinical arena. And then I started to reach out to key patient advocates, and I just built up from there. And then I started to validate what I was learning. And there wasn't an easy way. And I think that really is, there's a great need for that, because some people aren't as active or as familiar with the clinical setting as I have been. And to challenge people is not easy, especially if it's your clinician. And I think the other thing is to find like-minded people. So sometimes I was talking to people that really weren't looking for the same goals as I was, and that's fine. But I would say I've managed now on my journey to find people who are on the same journey as me, and that works really well. And like I said before, validating your information, it's a bit of a minefield if you go onto the web or you go onto social media. You need to check what you're reading and if it actually is accurate or not. And I think the courage to challenge the establishment is so important. I have met people over the last 4.5 years who have not felt comfortable challenging their clinician and have been frightened or to upset them if they want to move. And I think it's that advocacy for yourself that you have to find as a caregiver to support the person you're supporting, to say, look, come on, this isn't working. We need to look elsewhere, and it's okay to do that. And I think that's really much what Amy and I did when we decided to move. And Amy didn't want to upset anybody, but we clearly knew it wasn't working. We weren't under the right specialist where we were at the time. And time, you know, carers aren't always sat at home doing nothing. So you have to find time and look at how you're going to have your plan to be proactive, and you've got to be ready for the next stage. That makes you feel more positive and more in control. And be determined. You know, the UK is a great place, but there's people outside the UK that you could look at and read up on that have a great source of knowledge for us in the lung arena. And staying positive. I've popped that in because as carers, sometimes you're the one that's more stressed than the person. I mean, Amy is off to Glastonbury again next year, and I'm the one trying to make sure everything's okay, and that's fine. But actually, the carer has to stay positive as well, because it's hard for the carer and for the person who's got this chronic cancer disease, where we'd like it to be a chronic disease for sure, but the cancer. So so that would be really the challenges. And Alfonso, if I could have the next slide, please. So just to cover shared decision making. So we've gone from your partnership, we've got all our knowledge, then we've got to make, you know, what we're going to do with it. So we've obviously established our relationship, and it will depend when you come to make a decision, it will depend on where you are. So the patient could be very well and make their own decisions and don't really need the support, if you like, other than someone to talk it through with. But then you could have somebody who is not very well at the time and going through treatment, and really the carer needs to step up and perhaps be more of the person leading and helping with the decision making and having those conversations. The knowledge you've already got, so really it's a case of how do you use that. So Amy and I will normally discuss it, then Amy will decide, and then we just go from there, and that's how we roll at the moment. But Amy, for touch wood, luckily has not really been ill as such. She's just been on her TKI for 4.5 years, so she tends to take control and make decisions alongside my guidance. And then once you've got that, you can make a decision. You've got informed, you've got your information. When it comes, be it small or large a decision, you've got that control, and then you can move forward with your plan of action. So I guess in summary, this is an overview of how I would say a caregiver works, but also how Amy and I work as a partnership. And also, my last comment would be just, you have to advocate for yourself, and you have to be proactive and not be frightened to challenge and source out new information and support. Thank you.
Jan, thank you so much. Such a powerful presentation as well from the caregiver experience. And, you know, what you've shared is such a personal experience that you and your daughter have gone through. So I just want you to know that we really appreciate you being here today and sharing that with us, because I know it's not easy, you know, going through all of that. And I think one of the things that I'm taking away from all of the really, really important things that you've covered in your presentation is, how do you know what you don't know? So how do you know even what information you're looking for, or how do you even know where there's a gap of information? So it's really about trying to have some sort of, I don't know, cheat sheet or prompt sheet or something, you know, in terms of information. And I think the other really key thing that I've taken away is that it is okay to ask for another opinion. It is okay to go out there and say, do you know what, where I am now, I'm just not so happy and I want to see what else is out there. And I think for some of us, we find that really, really difficult to do for a number of reasons. But I think just hearing it from someone like you and hearing it from others, in a way, sort of gives us permission then to do it ourselves. So that was a really, really important message to come out from your talk as well. And when you spoke about sort of the informed consent and things like that from our report, and it wasn't something I covered within the time frame, but we see around the informed consent process that there's a substantial number of people who are not receiving all of the information they feel they need or understanding the informed consent process before actually signing the form. So again, a lot of more work to do there as well. But Jan, thank you so very much for being here with us today.
Thank you.
So if I can ask Alfonso to just pull up our slide. We're now going to move into Q&A. So we do have a little bit of time for some questions. So you can put on your camera at this stage if you'd like. You can use the raise hand function to ask a question. You can type the question into the meeting chat box as well, whichever you are most comfortable with. I know we've gone through quite a lot over the course of the presentations that you've heard, but if there is something you'd like to ask any of the speakers, please do use the raise hand function or chat or the chat function. And if you'd like to turn on your camera at this point as well, please do so. So maybe while people are having a little bit of a think, I think one of the things that I guess goes out to our three speakers is, you know, what can we do together now to put things in place where shared decision making is reality in the clinic? So maybe if I go to Georgia first, like where do you see, you know, where we can all come together and input into that to make this a reality? You know, are we a little bit of the way there? Is it something that started, but, you know, there's still issues? Like, how do you see clinicians working with people in a caregiving capacity, people living with the disease, patient organizations, and so on, to help move this process forward? Because from the presentations, we can see that this makes such a huge difference for everybody. So you're on mute, Georgia.
Sorry. Thank you, Anne-Marie. That's a very interesting question, actually, because at the end of the day, it's all about bringing everyone together. So from my point of view, there's a great diversity in terms of the shared decision-making process across European countries. And maybe we take this for granted, that this is something that is happening anyways, but it's not happening. And even if it's happening, it's not on the same way. So it seems that both sides have sometimes different perception of how things should be done. Mm-hmm. So the way to take things forward would be to create a single language of communication for both healthcare professionals and patients in this direction of travel. So my proposal would be to have specific training courses / webinar. I think we can all, think further about the educational format, but we need to have specific dedicated training of our healthcare professionals in terms of the shared decision-making process, how it could be done by taking into account all possible aspects, not just the clinical ones, but also the patient's perspective, clinical background, values, priorities, etc., and to work closely with patient organizations to facilitate this brief curriculum and bring it into practice through an educational form. In my mind, that's the way forward, because otherwise we will all be exchanging views, but actually we need to make an intervention. And I think this platform right now is a great opportunity for us to take this on board. Thank you.
Thank you, Georgia. Yeah, it's about sort of the consistency. So it's not that we're creating things, but even while we're creating things, we're further increasing the inequities, that it's for some and not for others. I mean, it has to be something that, you know, could be applied across no matter where you are or what centre you're being treated at and things like that. So I just want to offer Nicolene and Jan, if there's anything you would like to add to what Georgia said from your perspective.
I totally agree. I totally agree with Georgia, because she had everything in this. And I think that we need programs and guidelines. And since all patients throughout Europe are the same with their lack of information and things like that. We probably should do this not in a regional way. We should do it in a European way. We should find a European way to have guidelines and programs. That is what I think about it.
Mm-hmm. Jan, would you like to add to that?
Yeah, I would just second that. I just think it's so important, you know, being on my journey, and I was looking back, what would I do differently if I had my time again? And I would have moved Amy earlier. Touch wood, it didn't make any difference to a treatment plan, but it could have done. And I think for me, I mean, hindsight, a great thing, isn't it? But let's not have people put in that position in the future that they don't have to learn by their mistakes, that they can start strong at the beginning.
Mm-hmm. So we've gotten some questions in through the chat, so I'm just going to go through them here. So we have a question in from Victoria. Victoria works in developing medical education for healthcare professionals, and she'd love to hear perspectives on how we can use the findings from this report to help to empower our healthcare professionals to address these gaps. So maybe, George, if I could go to you, like the key takeaways from this report, can you see how you might be able to help to implement those or make people aware of it within your practice or your centre, within your network?
Thank you for that, Anne-Marie. So I was devastated, to be honest, by the results of the survey, because it shows that we have, as clinicians, completely different perception from what is happening with our patients. And I think that was quite an awakening call. So moving forward in terms of changing clinical practice, I will identify 3 areas, and this could potentially be the basis of this single educational format that we can discuss on outside this meeting. So A, better communication in lay language in terms of the diagnostic and management plan. Clear language, lay language, as one of my patients used to say in the past, Georgia, you need to be able to understand that you're talking to a clever 15-year-old. This is the actual situation. So yeah, be able to communicate clearly the diagnostic and management plan in lay language and give a clear timeline, because patients also have their lives, they have their lives, they've got financial constraints, social constraints, all these need to be encountered. Ask the question, what do you think about it? Openly ask the question to our patients, because if you walk into the lung cancer clinics, sometimes in some European countries, it's just physicians announcing the plan without asking any input at all. And the third bit, it would be to work closely as a first line with the local patient organizations, because the majority of trusts, they've got their own local patient organizations. So touch base with them, try to find common ground, and try to create a platform to facilitate the training on the ground. I think it should be centralized in terms of having a single curriculum, but in terms of the delivery, you need to be able to have it across all centers and across all countries, have the same standards, but deliver it locally so that it's accessible by everyone.
Nicolene and Jan, would you like to add anything to George's reply around sort of developing and using this report in terms of healthcare professionals?
I think, Georgia, you touched on it. It's one thing having that information and making it simple, quite rightly for the patient carer's perspective, but also getting the clinicians to be upskilled and to share it as well, including GPs. You know, in the UK, for example, you know, it's a whole, it's everybody, it's multifaceted, isn't it? Lots of people have to be involved to make it successful. And I think that would be included, isn't it, in how we educate and then disseminate the information to get that result.
Yeah, absolutely. So there's a couple of other, oh, go ahead, Nicole, sorry.
No, I have nothing to add, just.
So some other questions that have come in, there's one in around speeding up the screening process for vulnerable communities and the methodology for their proper care. So I think that is a pretty complex question in terms of, it's not even that we're have screening programs up and running in the majority of countries. It's about even getting them up and running, getting them implemented, and, in particular then trying to access more vulnerable communities. So I think it is a very hard question to answer, because I don't think we have the answers in terms of that. But I don't know, Georgia, maybe you would like to make a comment on that in terms of vulnerable communities around screening.
Thank you for that, Anne-Marie. So I quite agree with you. So we're not there yet, because we don't have national screening programs across Europe. We just have 3 European countries, and we also got the UK, which is basically running a national program, but it doesn't have the label of the national program as yet, if that makes sense. So
Yeah.
they meet all the prerequisites and the quality standards. It's just the label it's slightly different. So we're not there yet. I think we will be able to look into that once we've got national programs implemented across Europe. Then we drive them forward for a few years, and then we go and look back into the data and that we have collected, and then we will be able to draw some safe conclusions. From now, for the time being, we've got data from the US at the moment, and we know what happened there in terms of the accessibility in candidates with lower socioeconomical status, and also the pickup rate was not that great despite dissemination. There's several reasons for that. In Europe, we're not there yet.
Yeah. So it's a really important question, but just something we don't have an easy answer to right now. I'm going to take another question from the chat. So it's around lack of information for people about biomarkers, and they feel, well, they're asking, isn't it at least in part due to a disparity of biomarker testing practices, which makes it then even harder to understand? So, I mean, we absolutely see disparities in terms of access to biomarker testing. Some of it might be reflex testing, some of it might be broad panel testing. It really varies of where you are and where you're being treated. But if I can come to Nicolene and Jan, because obviously you guys are dealing with oncogene-driven disease with both your daughter and you yourself, Nicolene. So what do you think in terms of when you were looking for information about biomarkers, or was it something that sort of came after the fact? Maybe you would like to share a little bit about your experiences in there. Maybe Nicolene, I could start with you.
Yeah, to my experience, it's the way how you test is the second question. The first question is that people know about biomarkers and what they mean for their treatment, for their options, because there are too many patients who don't even know that biomarkers are existing and what they mean and so on. And this is the first problem we have to solve. And this is throughout Europe all the same, because if you ask a person in Romania or in Germany or in UK, they just simply don't know the importance of biomarkers. And the second thing would be, okay, of course we need NGS. Best thing would be reflex testing, and this is something we should do afterwards, just to make first sure that people know of the importance of biomarker and biomarker testing, and then tell them what would be the best way. And I don't want to put people in the situation that they think, okay, we've just got single gene testing and this is not the right way because there's NGS and so on. And this is just frustrating for patients, and it's of course, it's confusing. So let's focus first on biomarker and biomarker testing and the importance, and second, tell people what would be the best way to do it.
Okay, thanks, Nicolene. Jan, from your perspective?
Yeah, I think for us, when Amy was diagnosed, they said, oh, we've done a test, but it'll probably come back that it won't, it's very unusual, 3 to 5% of people come back positive. So they said they'll just start her straight on chemo, and then they rang her up and said, oh, you know, not it's your lucky day, because it's not your lucky day, but you know, it's good news. You have come back positive and you can start taking medicine. We had no idea it was a biomarker test. Thank goodness they did it. But they said to me at the time, and I've told this story before, is they said, but if you, and I asked them a bit about, you know, how many people come back positive, and they said, we have quite a few in this trust, but if you lived in Wales, they haven't seen one for years. And I remember thinking, well, that's a bit odd. I wonder why people in Wales don't have many patients with ALK. And again, I didn't know what ALK was at that moment in time. I now know they just don't do so many biomarker tests as back then, which is quite frightening because, you know, but that's just to show that we were under a trust that was forward thinking and did the biomarker tests. And then Amy very quickly, without any chemo, because you hear people are on chemo for a year, then they have a biomarker test, that she could go straight onto her TKI. But yeah, I mean, they were forward thinking, but I didn't know what it meant and I didn't know what the results were. And again, if I had the results, would you know what it meant? You know, you see people share their medical records on Facebook and then people give advice. You're thinking, well, actually, unless you're a real clinician, do you really understand it? It could be more frightening than anything sometimes, can't it?
Yeah, I mean, I think it's that, you know, taking things with abundance of caution because, you know, that sort of translation of that information could impact decisions that, you know, you're going to make and then, you know, what's going to happen after that. So I am conscious of time because I'd like us to finish on time. I appreciate we do have other questions in the chat around AI, telehealth, at-home care, and also about care for those who are older, who might have to live without having a caregiver near them. And I think in terms of people who are elderly, who may not have someone who is with them, the question also asked about the government taking care of such people. I think that's an individual country thing in terms of what sort of home care supports they have. I know it varies very widely, and in some countries people have to pay for this privately to have someone in, but it does vary widely. And in terms of AI, there's a lot of stuff going on in AI at the moment. And in terms of telehealth, it was something that was more common in COVID time, but it not necessarily has continued now post-pandemic. But again, it varies depending on where you are. But I know there's a lot of things going on in both of those areas around AI, telehealth, and so on. So I've just been alerted that there's also messages in the chat. So we have Q&A, a little box for Q&A, and we also have the chat box. So I'm just going to have a very quick look in here because, again, I am conscious of time. So we have Jared Walls, who's a radiation oncologist. So talking about developing a multilingual online education resource that clinicians could signpost patients to and how it would need to be layered and accessible. So maybe Georgia and Jared should get in touch with each other because obviously, Georgia, you were talking about trying to develop a program. And then we have Lavinia, who's a fellow board member, who's in It's Brightening to hear of such experiences and ensuring the importance of having a key worker allocated to people with lung cancer and having holistic needs assessment carried out at different time points across the disease journey and making sure there's the involvement of the caregiver within that. So Lavinia has also suggested that people ask for a point of contact, like a telephone number or an email, and also, again, like you have said, Georgia, and as Nicolene and Jan has also inputted into around this communication and suggesting around an advanced communication skills course involved for everyone involved in the pathway. So thank you all so much for taking those questions, and thank you to our audience for being so engaged and active. And I'm now going to go back to the mission control to Alfonso, who's just going to share the next part of this, which is going to be a short video from Sean Kelly from MEP, who's an MEP. So Sean Kelly is a previous member of the MEP Lung Health Group, and he has also previously supported the work of LuCE and has hosted us for a report launch during COVID times. And it's great to have his continued support of the work that LuCE is doing and of his interest in the lung cancer space. So if Alfonso, if I could get you to play this short video message from MEP Kelly.
Dear Corda, it is a privilege to be asked to address you today on one of the most pressing health issues of our time, lung cancer. Thanks to insightful reports like the 9th Lung Cancer Europe report, we as policymakers can make informed decisions on where to prioritise action. And the findings are clear. Lung cancer is a public health crisis that requires urgent attention. Lung cancer is not just a medical issue. It has high incidence, high mortality, and a devastating impact on the quality of life for those affected. It remains one of the leading causes of cancer-related deaths across Europe. When compared to other cancers, it presents unique and significant challenges, and the need for early diagnosis is more crucial than ever. Early intervention can save lives, but there are gaps in our awareness, understanding, and response. One of the key challenges we face is lack of awareness. 55.3% of people diagnosed with lung cancer were unaware that they were at risk before their diagnosis. This extends beyond smoking to include other risk factors such as radon, asbestos, and environmental pollutants, which are often, sadly, overlooked. Equally concerning is the lack of understanding about symptoms. Many people do not recognize the early signs of lung cancer, such as persistent cough, chest pain, or unexplained weight loss, symptoms that could prompt earlier diagnosis. In fact, 65.1% of individuals delayed seeking medical advice, with many attributing their symptoms to other conditions or failing to connect them to lung cancer at all. As previous Lung Cancer Week Europe reports highlight, the implementation of screening programs is crucial for earlier detection. However, our findings show a troubling gap. Many patients are not familiar with available screening tests, pointing to a critical lack of education about the importance of early detection. That is why we must act now. We need to raise awareness about lung cancer's risk factors, symptoms, and the importance of early detection. We must invest in education, the public and healthcare professionals, ensuring that everyone understands that anyone with lungs can get lung cancer, and that includes the whole human race. The role of patient organizations is vital. These groups are on the front lines, advocating for the needs of those affected by lung cancer, raising awareness and pushing for better healthcare policies. As a member of the European Parliament, I stand with Lung Cancer Europe and support their efforts to advocate for the rights of lung cancer patients and their families. As policymakers, it's imperative that we put public education, widespread screening, and risk reduction strategies on the agenda. By acting now, we can give those affected by lung cancer a better chance at survival and a better quality of life. Wouldn't that be lovely?
Oh, that was a beautiful message from MEP Kelly, and we really, really appreciate him and his continued support in presenting us that video. So if I could ask Alfonso one last time to bring up the slides. In the couple of minutes we have left, I'm just going to give a brief summary and call to action. But I have to say, in terms of the summary, I feel there's just so much we can all take from this. not only from the great messages from our MEPs, but also from all of the speakers, and obviously as well from our 9th LuCE report. I think the thing that has really struck out to me and that is going to stay with me is something that Nicoline has said. It's about ensuring that you're taking away this feeling that it's treatment that's happening to them, to taking it to treatment that's happening with them. And I think we can see just how transformative that can be and the difference that it can make. And we should never, ever, ever underestimate the power of our words, the power of our communication, because that can make a huge, incredible difference in the lives of those living with this disease. And I think that's the summary that I'm going to give you from this. So with that, I'm going to go into our call to action. So after all of the information that we've heard, our call to action, we've tried to surmise that into 2 key points. We really need to ensure that there's raising of awareness of lung cancer and early detection, and to support risk reduction efforts. We also, Alfonso, if you can just click on our 2nd action point. We also need to enable shared decision-making, because we know that shared decision-making can help to improve quality of life. So those are the 2 key call to actions from this extensive report that we're launching today. And the QR code that is there is, the report is now live on the website, and you can scan that report QR code. And Tiani has also put the link into the chat. So if I can just get the very last slide. I'm always, second last slide, apologies, is that we have a 9th report toolkit, which is full of a lot of different things, from the report to executive summary to infographics and videos. So again, if you check out our website, you will see all of these things in our 9th report in a number of languages. Please go in, please use them, and please share within your community. And now for the last slide, it's a thank you slide. I am in an extremely privileged position that I can be here and close out this meeting with the extensive number of thank yous that I have to give for this event, and it shows you the power of the community. I want to thank MEP Andriukaitis for virtually hosting us. I want to thank MEP Kelly for his video message of support. I want to thank Lungs Europe, ELF and ERS for their support, with a huge special shout out to Martha Montanari for her massive support that she's given us. I want to thank our speakers, Georgia, Nicoline and Jan. I want to give a huge thanks and shout out to Alfonso and Tiani and Mission Control for helping run this event so smoothly. I want to thank our sponsors, without whose support we wouldn't be able to do the things that we do for our community. I want to thank the LuCE executive team and my really amazing LuCE executive board. I want to thank all of our members, especially those who supported this report, in particular the members of our LuCE Report working group, who did a huge amount of work. And this was headed by the amazing Diego Vallon from Foundation Mass Case Ideas, who did amazing work on this report. And last but certainly not least, I just want to thank each and every one of you who participated in the survey, because without you it would not have been possible. So thank you all so much for being here. Let's go out there and continue to work for improved outcomes in our community, not just during Lung Cancer Awareness Month, but every month. Thank you all so very much.